Okay, well, I think we could begin now, and for those who join late, I'll just be sure to let them in. So, welcome everyone. I'm excited to have this discussion with you about the role of mindfulness in ADHD. My name is Mina Boazak. I'm a psychiatrist and clinical informaticist and the medical director at Animo Sano Psychiatry, a clinic where we focus on the management of patients with ADHD. So like I said, I'm the medical director at Animo Sano, but I also have several other roles. In the interest of disclosure, I consult with a multinational mid-sized startup, Paul Musk, and I do some research with Emory, and I don't have here Duke on various different topics ranging from machine learning through to provider burnout. Okay, so today we're here together to talk about mindfulness and the role of mindfulness in ADHD, and I do have an agenda today. And my aim is to try to convince you of the relative benefits against the non-existent costs of engaging, well, non-existent's not true, against the costs of invested time in engaging in mindfulness to you. And I hope by the end of this that at least one person here is open to the idea of practicing a little bit of mindfulness on their own after this session. And perhaps it was obvious through the name of the session on Meetup, but it wouldn't be good to have a mindfulness session with without at least practicing a little bit of mindfulness together. So if you're open to it, I'd like for us in the moment to do a 2-minute meditation exercise. I hope you're seated in a comfortable position. If not, get comfortable. And the same for those of you that are standing. And together I want us to start moving our attention to our breath. I want us to start becoming more aware of our breathing, inhaling in through our nose, exhaling out through our mouth. And just raise your awareness to your breath. You may find as we do this that your mind wanders a little bit, and that's fine. That's what minds do. When your mind wanders, just bring back your attention to your breathing. Notice the air passing through your nose into your lungs expanding and then collapsing as you exhale. In through your nose and out through your mouth. All right, I'd like to bring you back to this session and this moment with us together. Thank you for doing that with me. For those who haven't practiced mindfulness meditation before, what we just did is an example of that. The anchor in this session was our breath, but the anchor could be different things. It could be the feeling of your pants against your legs. It could even be attending to your own attention in something we call metacognition in the world of mindfulness. So what is mindfulness meditation? John Kabat-Zinn, who's done a lot of the work on mindfulness meditation, describes mindfulness as paying attention on purpose in the present moment without judgment. And that's a packed statement. It really does describe mindfulness well. The purposeful directing of your mind in the here and now to a sensory or non-sensory anchor. By example, we purposefully brought our minds to the sensory anchor of our breaths going in through our nose and out through our mouth. And we can even, through mindfulness, attend to our own attention, that metacognition thing I told you about. And in fact, as one practices more and more mindfulness, the metacognition piece almost comes naturally. It's not an attempt to control your thoughts. It's not an attempt to change your thoughts. Rather, it is merely observing. And the benefits of mindfulness of doing that alone for the studies vary anywhere from 5 to 20 minutes a day, and the benefits are derived as soon as 4 days of practice, actually as soon as one session of practice through to years of practice, have been conclusively demonstrated. The jury is not out on the role of mindfulness. We have a lot of research indicating the benefits of mindfulness. And here are just a few examples of the types of benefits you might see if you practice mindfulness regularly. Psychologically, people notice an improvement in their sense of self-control in spiritual experiences. They notice reductions in their distress, anxiety, and depression, in their social anxiety, reductions in ruminations and distractions, increases in empathy, improvements in derived meanings from life, improvements in ability to manage one's life, reductions in rates of burnout, improvements in self-compassion, improvements in satisfaction with life, improvements in metacognition, increased abstinence from substance abuse. And from a medical perspective, mindfulness has been found to increase antibody titers to influenza vaccines. It's also been found, my screen is meant to, there we go. It's also been found to reduce blood pressure, to result in reductions of atherosclerotic plaques, which are the sources of heart attacks. It's been found to reduce incidence of myocardial ischemic events during induced sessions, and to reduce overall mortality risk. If you're the type of person who's skeptical about mere writing that Dr. Boazak has on a slide, perhaps seeing is believing, and seeing the neurophysiological changes demonstrated on neuroimaging would be helpful. Mindfulness has definitively been demonstrated, I shouldn't say definitively, has been demonstrated to reduce activity in certain brain regions that are associated with distractibility. These include the medial prefrontal cortex and the posterior cingulate cortex in experienced meditators versus normal controls. Incidentally, it also has been demonstrated to improve synchronous brain activity or connectivity between brain regions. And the screen here is fairly small, but that includes connections between the posterior cingulate cortex, the dorsal anterior cingulate cortex, And over here, the dorsolateral prefrontal cortex, again in experienced meditators versus controls. And in addition to that, even in inexperienced meditators, mindfulness has been demonstrated to alter brain activity in the dorsolateral prefrontal cortex based on just a couple of sessions of mindfulness meditation. And the consequence of that for inexperienced meditators is a reduction in pain. Here we see from the study in the image that I showed before that mindfulness meditation, as compared to sham meditation, which is just asking someone to breathe in and out without observation necessarily to their breath or observation to any anchor, versus placebo. In this case, it was lidocaine cream versus control, which was nothing at all. We find that mindfulness reduced the group's perception of pain. And why is it that these neurophysiological changes are important? Well, they're important because a lot of these changes are in regions that are typically highly active in the default mode network. Why that's important for us is, in talking about ADHD, the default mode network is an important network to take into consideration as it is central to the mind wandering state, the daydreaming state. Many of the types of symptoms we see in the inattentive ADHD individual. And in the default mode network, two of the biggest structures are two structures that we actually referred to earlier, the medial prefrontal cortex and the posterior cingulate cortex. Two structures that have been demonstrated to show reduced activity with experienced meditators. Uh, it's besides just the pontification of the role of the default mode network in ADHD, the network has definitively been shown to be dysregulated in ADHD. And we also know that stimulant medication improves default mode network activity in ADHD. More recently, there's actually been demonstration that meditation normalizes default mode network activity in patients with ADHD. And the consequence of that have been demonstrable improvements with mindfulness meditation in adolescents and adult patients. And that includes things like improved attention, cognitive inhibition, and overall satisfaction with programs in adolescents. The same for parent rated indications of oppositional problems and conduct problems in adolescents. And adult self-reports, adult and adolescent self-reports, were also demonstrated to show improvements in inattentive symptoms, hyperactive symptoms, depressive and anxious symptoms. And a study in 2013 conducted by John Mitchell out of Duke, actually, an individual that I refer some of my patients to, demonstrated large improvements with mindfulness meditation in self and clinician-reported executive functions and emotional dysregulation. And in this case, I think a picture or a graph speaks a lot better to the types of benefits we see with mindfulness. Here you have graphs of the total ADHD symptom scores as measured by clinicians to the left and by patients to the right. In the top are total scores over time, over here are inattentive symptoms over time, and down here are hyperactive symptoms over time. And what you see is that as compared to treatment as usual, which is this top line, and treatment as usual could be stimulant medication, therapy, anything else, the combination of treatment as usual and mindfulness results in larger overall reductions in ADHD symptoms. And that's the bulk of today's talk. I had wanted to give us the opportunity to see what the current evidence says about the role of mindfulness, the neurophysiological changes that are seen with mindfulness, and the types of benefits that someone with ADHD might notice with mindfulness. I want to now turn the session to you all and see if if this has, and perhaps you could in the moment ask yourself if this has at least even begun to pique your interest in the potential benefits of this thing called mindfulness meditation. Do you think you'd be interested in incorporating mindfulness in your life? And if so, what's a realistic goal for you? What's what I like to talk with my patients about, the minimum measure of success. Is practicing mindfulness for 1 minute, 30 seconds, even 10 seconds a day realistic? And it may seem ridiculous, the idea of practicing for 10 seconds, but oftentimes we find that when we start to do something, we find ourselves doing more and more of it over time. But the key is to make sure that you're giving yourself a pat on the back when you are doing the minimum measure of success. And if that's 10 seconds a day, then excellent. If you are going to practice mindfulness, what's the best time of day? Is it morning, night, as you're brewing your coffee? And what could get in the way of you practicing if you decide to practice today? And with that, I'd like to end the session with one more 2-minute mindfulness meditation prior to opening the floor to questions. So again, I want you all to bring your awareness back to your breath. Notice yourself breathing in through your nose and out through your mouth. And as you do that, take note of your breath passing through your nose, expanding your lungs, expanding your stomach, and then passing through your mouth. Again, your brain might wander, but that's what it does. When it does wander, take note of it and bring your awareness back to your breath. In through your nose and out through your mouth. And with that, I'd like to bring us all back to the session. Okay, so I want to welcome you all to ask any questions you have. Today's was a short but hopefully sweet session. I did mute someone during the meditation. That was just to make sure that everyone was in their own space. But feel free to unmute yourself if you have any questions. All right, just feel free to ask.
I have a question. How does mindfulness work with the typical drugs used to treat ADD?
Yeah, so that study that I showed earlier, let's see. So these graphics are actually in reference to treatment as usual versus treatment as usual and mindfulness. So the combination of mindfulness and stimulant medication or non-stimulant medications aren't contradictory. Rather, there are additive benefits. Thanks for the question, Joe.
Can you show in that picture again? Just so I'm trying to understand.
That's what we're looking at over here.
Okay, can you show? Okay, so one is just medication, and which one is medication and mindfulness?
So the top is just medication, and the bottom is medication and mindfulness.
And we're trying to get lower numbers. I'm not sure what does the graph say.
Yeah, so these represent ADHD symptom scores. So higher is worse, lower is better. And what you're seeing is that over time, medication alone or treatment as usual, which can be medication or something else, results in its own improvement. But the combination of mindfulness and treatment as usual results in even more improvement.
And are there any studies that you did with just the mindfulness versus medication mindfulness?
I don't know that my sense is that that probably is out there. I don't know. I don't know of the studies, and I want to clarify that I didn't. I don't want to misattribute this to myself. I didn't conduct this study.
Okay.
But based on the current evidence of the impact of mindfulness, in addition to the clear connection between those brain regions that mindfulness meditation impacts and that are related to ADHD, which happen to be very closely linked. There is a clear relation, there's a clear impact of mindfulness on ADHD symptoms. From the perspective of a comparison of stimulant medication and mindfulness versus mindfulness alone versus medication alone, my clinical sense, based on what I've seen in patients who've practiced one or the other alone, is that the combination is likely going to result in the most improvement, and as compared to stimulants alone, mindfulness will result in a comparatively smaller improvement, but will still result in improvement in and of itself.
Okay, just to clarify, when you take transcendental meditation included in that?
Sorry, can you repeat that, James?
Yes. When you say mindfulness meditation, do you include the name transcendental meditation as in that group?
So I'm talking about mindfulness in specific, but there's plenty of evidence to suggest that the major types of meditation, and in fact the neurophysiological changes I showed here, these are actually due to these are based on experienced meditators of 3 different types of practice. So of the main types of meditation, there's plenty of evidence to suggest that meditation alone, when practiced, results in neurophysiological changes that would be expected to result in ADHD improvement. I would expect to result in ADHD improvement.
Can you name the other 2 then, if transcendental is one of them?
In this case, I think concentration, I have them here. Sorry. So this is choiceless awareness, loving kindness, and concentration were the three types of meditation that were looked at here.
Love and kindness. I've done transcendental. That was pretty good. I've also done house. I don't know if you've heard of house. I get better on the West Coast, and they do online.
Yeah, you're cutting in and out a bit, James, but
Okay, I've done transcendental meditation, and I've also done Paust meditation, which is
and
meditation taught in groups in Oregon, I think.
and really what it comes down to with meditation. So we've only talked about mindfulness today, but what it comes down to for everyone who's here is picking a approach that best works for you. And if you find that transcendental works best for you, then excellent. If that's the best practice for you that you could engage in on a day in, day out basis, continue with that. If it's mindfulness, great. If it's loving kindness, great. Just making sure that it is what works best for you.
Thank you.
I've got another question, if I'm not stepping on anyone else. Now, I've read where Thomas Brown insists that ADHD drugs are like glasses, eyeglasses. They don't change your brain. Basically, they just improve the symptoms as long as they're in effect. Meditators insist and have some evidence that they change their brains. Okay.
So, go
So
ahead, Joe.
if you could just comment on that, because it would just, I don't know. It would just seem that drugs would do something, but is there a combination of both that's been going on long enough with a group that you can actually see some neurological changes?
Yeah, so to answer that question about, well, to comment on the point of ADHD drugs don't do anything to your brain. What ADHD in the moment when someone is taking the medication, we definitely see neurophysiological changes in the brain regions that are typically dysregulated. So that's a good thing. The long-term benefits of if one were to take ADHD medication alone and not work to change their day-to-day practices, it's not likely, sort of like the example of glasses that you give, that with discontinuation, they'll see any further change in their baseline neurophysiology. With mindfulness, there definitively is or are indicators that there are, I don't want to say the word permanent, but there are long-term changes due to mindfulness practices.
Is there a specific mindfulness practice to ADHD? Possibly, for instance, if you have a project you're working on, a book to read, a lecture to note, or a problem of work to solve, is it best to do this practice right before for 20 minutes or 5 minutes, or uh, any guidance on that?
Well, it's so there's that's a two-part question. I'll answer the first one first. So a specific mindfulness-based practice for ADHD. Yes, UCLA has developed the MAPS ADHD practice, and I'm happy to share that information with you all after this session in the meetup. Um, in terms of what to do before a particular task. Well, the practice of mindfulness alone has been demonstrated in the moment to reduce to result in improved distress tolerance, and reduced distractibility after 20 minutes of mindfulness meditation. The reality of it is the consistent practice of mindfulness improves one's awareness of their thoughts and their emotions and the impact their thoughts and their emotions have on their day-to-day behavior across the day, not just while you're mindfully meditating. And the consequence of that is reduced distractibility and improved overall attention to your day-to-day goals, objectives, hobbies, passions, whatever it is that you would be working on, and increased derived pleasure from engaging in those things.
Yeah, thanks. And yeah, if you could share that UCLA MAPS ADHD plan, I guess
Yeah.
by mail or whatever you
And
do.
one thing I like to recommend to all my patients who are interested, and this is something I failed to mention earlier, who are interested in practicing mindfulness, there are apps for mindfulness. And two of them have been studied in randomized controlled clinical trials. The two that I'm thinking of, one of which is free, is called Smiling Minds out of New Zealand, and the other one you might have heard of is Headspace. Smiling Minds is, last I checked, without cost. Headspace, I believe, is a $10 a month fee. I recommend both of them. I personally use Headspace. I have no affiliations with either. But if you're interested in a guided mindfulness meditation approach, Headspace and Smiling Minds are two excellent apps. And Joe, regarding the MAPS UCLA program, it's an ADHD program that actually requires attending group sessions. So we have someone locally who practices that, and that's John Mitchell. He runs group sessions every couple of months, but I'll share more details about the MAPS program with you.
Thank you.
Pablo uses Calm. Thank you. Calm is another good one.
Thank you, Pablo.
You're welcome.
Okay. Missy Samuel asks, is the practice of mindfulness different for each person? If so, how can one find a technique that best fits them? The experience of mindfulness meditation is likely different for each person. What do I mean by that? In beginning the journey of mindfulness meditation, some individuals may experience the act of directing their awareness to an anchor to be much more challenging than others. The main aim is to detach the practice from the judgment of how one is doing. So regularly sitting in a space where you're being reminded that there is no right or wrong here. You're just constantly trying to bring your awareness back to your breathing or back to the sense of your shirt on your body or to the sense of your back against your chair. Some individuals misattribute that to being in for the end aim of quote unquote controlling your thoughts. That is not the end aim of mindfulness. By happen chance, with practice, you'll find that your thoughts are less cumbersome, less distressing, and less emotionally dysregulating. But that is in part due to your own growing recognition that the thoughts do not represent you, but are merely a part of your mind that you're not in control of. So what do I mean by that? When we think of ourselves, we could almost think of delineate ourselves as Freud would into a conscious and unconscious, into having a conscious and unconscious mind. The unconscious part of our mind is not within our control and does not represent who we are. The conscious part of our mind, which does in part include our thoughts, more closely represents that individual we would like to identify with, the individual who has dreams and hopes, who wants to play the guitar, or who wants to paint on their canvas, to walk in the park with their spouse or with their child, or walk in the park by themselves. And oftentimes we end up associating the feelings that come from the unconscious, which can be random, and the thoughts that are directed from the unconscious to the conscious, which in and of themselves can be random. We associate that with ourselves, with our conscious state, and with who we would like to identify with or to aspire to be. The challenge with that association is it could lead to distress, discomfort, and the practice of mindfulness allows us to separate those two individuals, so to speak. And in so separating, we end up becoming less distressed by those thoughts that come at random and also go sort of like the waves of the ocean. That is a very poor attempt at describing what mindfulness is, but I hope it helps a little bit. Talisa asks to go back 2 slides. Were you looking for this, Talisa?
No, I think it's the next one. Oh, no, maybe it's the next one. Oh yeah, the one before the DMN activity.
This.
Default.
Default mode network.
Yeah. Okay.
So Kendra, you bring out a really interesting point, which is mindfulness. So typically, when practicing mindfulness, we would normally recommend practicing mindfulness meditation in a seated position, in a resting state. But actually, the practice of mindfulness meditation for ADHD patients, because of the role of ADHD leading to that sense of restlessness, has been adapted to include practicing mindfulness while walking, or in your case, while doing the dishes, so long as you don't accidentally break the dishes while attempting to practice mindfulness. All right, everyone. Well, I hope this helped some in at least demonstrating some of the benefits of mindfulness. Thanks for taking the time to join. Next month, I think I'm just going to do a question and answer session. And for those who join, I look forward to sitting with you and having a discussion together.